Good afternoon. My name is Kamlesh Kaur and I'm a health educator at Stanislaus County Public Health. This is your COVID-19 update for Thursday, July 30th. As a reminder, the data I'm sharing today is also available at stancounty.com/coronavirus. During these past 7 days, we have seen an average of 215 new cases per day. Almost 10% of our cases within the last week were those of children under 18, making up 138 cases. Over 50% of our overall cases are of people under age 40. Currently, our hospitals are reporting 50 positive cases in adult intensive care unit. Our hospital's ICU capacity is still at a critical level with only 7 out of 120 beds available. The increase in number of ICU patients due to COVID-19 indicates increased risk for those working in healthcare settings. Reduced number of beds for individuals needing intensive care services from other illnesses and increased usage of critical resources such as personal protective equipment, among other supplies required to care for COVID-19 patients. As of this briefing, we have lost 103 members of our community to COVID-19. Our sincere condolences goes out to those who have lost a loved one. At a time like this, when so many of our community members are coping with loss of job, pay cuts, and impact on physical and emotional health, the last thing we should have to go through is the trauma involved with loss of a loved one, especially from a preventable communicable disease such as COVID-19. COVID-19 infections are happening in the neighborhoods where we live, learn, and work as they affect a wide range of health risks and outcomes. When you see our areas with the most number of cases, these neighborhoods are home to majority of our diverse community members, including Latino, Asian, and Black community. Many of them represent essential workers in the main industries of our county, such as agriculture, farming, and food and beverage packaging and servicing. Many live in multi-generational households where grandparents, parents, and children live together, whether as cultural practice or to offset the rising cost of living. Our data shows that these workers may not have the economic security to be able to stay home when they are sick or have benefits such as sick time or employer-provided health insurance. Due to the nature of essential services, many are able to stay 6 feet apart, especially in jobs such as line packaging, sorting of fruits and vegetables, or elderly and child care. This is why it is essential for everyone in our community, including our employers, to support each other in slowing the spread of this disease. If you are an employer, please visit covid19.ca.gov to learn how you can support your employee in taking care of themselves during this crisis and prepare your workforce to prevent exposure. If you are exposed to COVID-19 and have symptoms, you should get tested. After getting tested, you must quarantine. If you develop symptoms in the meantime, please isolate. You can stop your isolation after at least 10 days have passed since your symptoms first appeared and at least 24 hours have passed with no fever, without using fever-reducing medication, and your other symptoms have improved. In the past couple weeks, if there is one thing I have learned about our community, it's the different ways in which we have come together to show that we care for each other. Preventing another death in our community through our actions is one cause that we all can get behind. Please wear a face covering. This small action can protect someone's life by preventing the spread of respiratory droplets. When you're out in the community, please respect each other's space, especially those who are not a part of your household. Most of us, including myself, have an unconscious habit of touching our mouth, nose, and eyes, and this action can easily transfer the virus from a contaminated surface. Please wash your hands to prevent this from happening. Finally, please stay home if you have symptoms of COVID-19. The best action we can all practice is self-care. we can all practice compassion, not just for ourselves, but also for those around us. Through these simple actions, we can stop the spread, prevent someone else from getting sick, and save lives. Thank you for watching today's update. Please visit Stan Emergency Espanol page to see this message in Spanish. And tune in for our next update on Monday, August 3rd. We got this, Stan. Our actions can save lives.